McDonald Army Health Center goes mobile with sleep studies, and soldiers receive post-deployment hearing tests. This is the Regional Health Report. Welcome to the Regional Health Report for October. I'm Ann Krebs. Sleep apnea is a serious disorder that prevents those affected from getting a good restorative sleep. Those who suffer from this condition, if left untreated, can lead to serious health consequences in the future. A sleep study often done at a healthcare facility is typically the first step to diagnose this illness. McDonald Army Health Center on Fort Eustis, Virginia, offers its patients another option.
I'd like to know if I do have sleep apnea, if that's contributing to the anxiety that I feel throughout the day, then, I'd love to have that addressed so that can, put an end to that. And also, I'd like to see what can be done about the snoring and about the pause and breathing during the night.
McDonald Army Health Center Sleep Clinic offers two types of sleep studies. One study requires an overnight stay at the facility. The other is a mobile or ambulatory study.
An ambulatory sleep study is a sleep study that gets performed, but it actually gets performed at your own home. Okay. You come into the clinic in the afternoon. You get set up with all the same electrodes, same wires, the same exact setup that we do for our inpatient, but you actually get to go home with a video camera, set that up, and sleep in the comfort of your own home. Our ambulatory setup is the exact same setup as our overnight. So it's a little bit more in depth, but it gives us better results.
McDonald averages about 18 ambulatory sleep studies per week. The average number of in-house studies are about 28 per week. A well-rested warfighter is a ready warfighter. This test is another tool that keeps them fit to fight. Go
down to medical, let them know how you're feeling and your concerns, and see if you can't get a referral, and definitely go get it checked out.
Symptoms of sleep apnea are heavy snoring, excessive daytime sleepiness, concentration issues, and waking during the night feeling short of breath. If you or a loved one are experiencing any of these, please see your doctor. Sleep apnea is treatable, preventing more serious issues and improving an individual's quality of life. In our February show, we visited with the 48th Infantry Brigade Combat Team as they participated in hearing readiness training with the Army Hearing Program U.S. Army Medical Department at Fort Stewart, Georgia. Zach Renstrom brings us a post-deployment update.
Hearing is critical to a soldier's job and mission success. Hearing is 24/7, 360 degrees. It allows a soldier to shoot, move, and communicate, which are the fundamental skills for a soldier to obtain their mission readiness.
After being deployed for over 6 months, the U.S. Army Hearing Program team examined the 48th Infantry Brigade Combat Team by conducting post-deployment hearing tests to keep the brigade mission ready.
We need to test each soldier to gauge what hearing readiness classification they fall under and whether they are fit for duty.
Our intent is to give testing and to identify soldiers with hearing loss and immediately treat for those hearing loss.
The hearing program team take hearing damage and hearing loss seriously and indoctrinate the importance of these post-deployment hearing assessments to the soldiers they evaluate.
Hearing loss is one of those injuries where you don't know what you have until it's gone. You really start to realize how much we rely on our auditory system and those cues every single day.
It's sometimes a struggle, more so to understand clearly what someone is saying, especially at distance. The words kind of get muffled, and you don't have time for that in most situations, especially in combat.
For the soldiers diagnosed with a significant hearing impediment, the team provide an array of auditory technology, such as the Tactical Communication Protective System, that can assist, improve, and balance a soldier's hearing.
That system allowed us to hear a lot better, a lot further, a lot clearer, and also allowed us to communicate with each other, even in low tones, and we could hear it crystal clear.
The ability to provide these soldiers with hearing technology, meaningful training, and counseling geared towards hearing loss prevention and readiness is an important part of the Army Hearing Program mission. For Wynn Army Community Hospital Public Affairs, I'm Zach Renstrom.
The Army Hearing Program continues to educate, advocate, and implement hearing training that continues to preserve soldiers' hearing readiness for when they need it most, on the battlefield. In other news around the region, we want to recognize our Regional Cadre Award for Excellence winners. These exceptional soldiers and civilians are responsible for the recovery of wounded, ill, and injured soldiers assigned to our Warrior Transition Units. Next month, they will compete against their peers from other units across the Army to determine who is best in the Army in providing warrior care. Cooler temperatures come quickly to Fort Drum, New York, as does the flu season. In preparation, the Fort Drum Medical Department activity held a nursing skills fair at Guthrie Ambulatory Health Care Clinic focusing on immunizations.
You just saw some of our nurses from the Occupational Health Department, and they were practicing their skills and getting a refresher on intramuscular injections and manual blood pressure before they start the influenza campaign in October. The purpose of this is to get hands-on training that's relevant to the nurses. We go to this section and we talk to the staff and we figure out what is going to be relevant training to them.
So we always want to make sure that you're confident in your needles.
And then we go and we build this training specific to them. We bring it to them in their location at a time that's convenient for them so that they can hopefully all go to training versus only some.
I still can get stuff done today. I don't have to block off the whole day to go to try and get into the stations that everybody else is trying to get into.
Our Commanding General, Brigadier General Michael Place, has been visiting the medical facilities within the region since taking command in July. These visits give him the chance to see the facilities and, more importantly, thank the staff for the job they do every day in keeping our soldiers ready and their families healthy. That's the Regional Health Report. Join us next month for another show highlighting healthcare and readiness across the region. In the meantime, don't forget to check us out on your favorite social media sites and on iTunes. Thanks for joining us.